Well, it can happen due to stress, injury, or simply because of over-tweezing. Women with thinning eyebrows rely on makeup or tattooing to fill in what they've lost, but often it doesn't look natural. Now more women are exploring a new option to transform their brows, hair transplantation.
As a kid, 53-year-old Sherry Verner of Long Beach was a fan of the tweezer.
Being a teenager and you do tweeze a lot, but I started noticing they didn't grow back.
Sherry's very self-conscious about her lack of eyebrows. She swims a lot, so makeup washes off, and tattooing them on didn't take. Hair transplant specialist Dr. Sean Benham says it's a common story.
The number one reason is overplucking.
Other causes include face trauma, burns, even thyroid problems. Transplanting hairs to the brow area is a fairly new procedure, but few doctors do it because it's such painstaking work.
It takes time and it takes patience.
Forming the brow is an exact science.
You want it to thicken on this part on the top?
Just slightly rounded.
Older methods require removing a strip of skin, then suturing or stapling the area, which creates a scar. Instead, Dr. Benham removes 300 hairs from the back of Sherry's head, one at a time.
We individually punch out and remove every graft. And once we do it, the skin just heals.
On the brow bone, he creates tiny holes and slides in each graft individually.
A lot of thought goes into implanting each and every follicle. You may not realize this, but your hair grows in different directions. So when it's placed on the brow, it has to be placed so it's facing the proper angle.
We want all the grafts to be at 20-degree angle, and we want the hairs to be facing inward rather than outwards.
The entire procedure takes about 8 hours and costs between $4,000 to $5,000. A week after, we caught up with Sherry. You remember her before. This is her after. Soon the hairs will fall out, but the roots will take hold and grow about an inch in 3 to 4 months. Sherry can't wait for summer.
Everyone should have eyebrows. We're born with eyebrows. So if you don't have any and you're that self-conscious as I was, I would recommend this in a heartbeat.
And another interesting note, hairs from your head will grow kind of wild on your eyebrows for the first year, but Dr. Benham says after that, the newly implanted grafts will learn how to act like regular eyebrow hair.